Welcome back. Luigi Mangione, the suspect in the killing of the UnitedHealthCare CEO, Brian Thompson, has now been charged with murder.
Completely out of touch and insult the intelligence of the American people and his lived experience.
Now, that is a video of the suspect yelling towards the camera as he entered the courtroom today. Police say, in addition to having a ghost gun and showing police a fake ID while being arrested, he was also carrying a handwritten manifesto describing, quote, parasitic health insurance companies, the same thing doctors are experiencing around the country.
I wrote a book about my own frustrations as a surgeon. I've been battling the system since I got out of the military in 2010. And it's a very difficult problem. We as providers and patients every day are facing the challenge of the insurance companies controlling medicine. Not only do they control the delivery of care, they decide what it's worth. It's the only system I've ever heard of where the people paying the bill decide what the bill should be. And then on top of that, they decide a lot of times not to even allow the care that a doctor is requesting. They deny treatment, they deny studies, they deny everything, all the way up to the level of life-saving surgeries. And it's a really frustrating thing for providers. I mean, if you talk to doctors nowadays, I would say that 86% of doctors, and this is actually borne out in the literature, 86% of doctors are considered depressed over the state of medicine. And
Wow.
I mean, it's a huge number. Doctors already have the highest suicide rate amongst professionals. And then now you add to that the challenges of making it financially in the world. There aren't any private practice doctors left. I'm one of a dying breed. There's 80% of physicians, and nearly 80% of physicians are currently employed by a system, whether it's a hospital or a corporation. And some of those corporations are the ones that are determining the cost of care. They're deciding based on how much it makes and not necessarily on what's right for the patients. So when you're caught in that equation as a patient, you're trying to get care that's been requested by your doctor and the insurance companies are denying it. Of course, it's creating frustration, anger, fear, and actually it's hurting people. So I do understand how people can get behind the idea that the system has to be fixed. Obviously, the answer was not to kill anyone. It's a terrible tragedy, like I said earlier, and I feel my heart goes out to the family. But the system is broken in a way that very few people understand unless they've been a patient or they've had a loved one who's been trying to get care. I battle the insurance carrier denials on a regular basis. You know, very often the way it happens is an administrator, not even someone with medical education sometimes, is the first line of denial.
One of the things I wanted to get to, Doctor, that you mentioned on your Instagram, and you talk about these topics and issues on your Instagram account as well as in your book. One of the things you said was you could be paid by the insurance company and they can come back, go into your bank account and take some of that money back.
It happens 8 to 10 times a year on average to our practice, where we have a pre-authorized treatment that they have authorized because it met criteria for surgery. We perform the procedure. And then they decide retroactively that, oh, actually, we don't want to have made that payment. So they have access to your bank account to deposit the money, but they also have access to retract the money. So they'll go in and they'll claw it back out without even asking you. So you end up realizing it after the fact that the money's been taken back. That, to me, that sounds like thievery. And I don't know how these things are allowed to happen. The process and the control is in the hands of the wrong people. The people that should be controlling medicine are the doctors who have devoted their lives to taking care of patients and doing the right things for those patients. You know, and even doctors have to be policed, and there are multiple levels of and multiple tiers of risk for doctors who are doing what's wrong for their patients. But there's really no risk for the insurance carriers to deny treatment. There's no risk, there's no repercussion. And I think that's where the problem is. The glaring problem we have right now is the wrong people have control of medicine.
And welcome back. Orthopedic spine surgeon Dr. Stephen Sear recounts his frustrations with health insurance companies, especially when it comes to those payments. And what do you think needs to be done? Congress, legislation, what, in order to fix this problem? Because the insurance industry won't fix itself. They won't take money out of their own pocket.
Right. Why would they? I think for sure it's all those things. I think the public has to be aware. The reason I wrote the book in the first place was really not to gripe about my personal challenges, but was really more of an expose on what's happening in medicine, because I don't think people realize how little say doctors have, how little profitability doctors have. If you look at the numbers now, doctors, their payment has reduced 50% since 1992, 50%. So how in the world can a doctor maintain a practice? 80% of doctors are now employed by a corporation because they can't run a practice in a profitable way anymore. So yeah, all of that has to happen. Congress has to stop being able to get bribed by the lobbyists. People have to have the patient's interest at heart. No one should be able to say, you know, the corporations dictate what's paid to each doctor. You know, even when it comes down to the way we're paid, we get paid by codes. So if I do a fusion on a patient, whether I do a good job or a bad job, it's a code. So you don't get paid for quality, you get paid for single codes, and that's a problem. There should be measures quality measures that dictate what you're worth and what you get paid. Doctors that have good reviews and good results should count, and doctors who don't, that should count against them. That's the only way to maintain a standard. But yeah, we need laws. We need to eliminate the laws. We need to eliminate the lobbyists. We need to eliminate the influence of big business and big pharma on the congressmen who are passing laws that ultimately end up resulting in care that's.
And I don't think many in the public realize, Dr. Sear, when you guys submit a bill to the insurance company, 9 times out of 10, they want to negotiate it down.
Well, when we submit a bill, you know, our bills are we're only allowed to submit one rate for every patient we see, regardless of how they're paying. Whether that's the Sultan of Brunei or a regular everyday American, our bills have to be the same. So whether insurance is covering it or it's an out-of-pocket cash pay, our bills always have to be the same. So, but we have in-network rates. If we're in-network doctors, we've agreed to a rate. So the bill is never, if you look at an explanation of benefits, it's what was billed and what was paid. And what really matters at the end of the day is what was paid, because that's based on a contracted rate. The problem is there's no negotiating power for doctors. Doctors don't have the ability to strike. Doctors don't have the ability to collectively bargain. We don't have that ability. It's actually against the rules and the law. We're not allowed to do it. And so what has happened is the insurance carriers have whittled down the payment month by month, year by year, so that now we're making a fraction of what we should be making when you adjust even just for inflation. And in fact, Medicare just cut our rates this year. And every year they propose a Medicare cut on doctors. Meanwhile, the insurance carriers are making, if you look at the numbers when I wrote in my book about the profitability, specifically of UnitedHealthCare, since Obamacare was enacted, UnitedHealthcare's profitability has gone up 1,750%. Meanwhile, the average everyday American is paying 3 times what they used to pay for healthcare. And the denials are at an all-time high. UnitedHealthcare, they have the highest denial rate, 49 to 46 to 49%. And there are some carriers, and that's the big insurances, and there are some carriers that have an up to 80% denial rate of pre-authorizations for treatment. Where in the world did they get that power, the authority to deny treatment requested by a doctor? It doesn't make any sense. It's crazy.
Absolutely. Well, Dr. Stephen Sear, author and orthopedic spine surgeon, we appreciate your time here on The Factor Uncensored. And for those who may be interested in your book and taking an inside look at the industry, what's the name of that book and where can they find it?
You can find the book on cutthroatbook.com. It's also on Amazon. But yeah, take a look at the statistics. You'll learn a lot of things about medicine you may not know about as a patient. I think you need to educate yourselves. We all need to stand for patient rights and patient care. We need to advocate for patients getting the care they need without anyone stealing the opportunity for health and a long, prosperous life.